usually at your first visit, after we've talked about, what your eye looks like and what we think you might have based on your exam and your history and what your family history looks like, we'll encourage you to have a targeted process of genetic testing. First, the patient needs to undergo a very thorough history gathering process. We need to talk about, what was their birth history, when did they start losing vision, what were their first symptoms, who in their family also have similar symptoms, extended family, cousins. And then we proceed obviously to the exam, what do their eyes look like. After we get a sense of what we call their phenotype, which is what it looks like, then we can proceed to the genetic testing. We'll either encourage you to have a blood test or a saliva test. And that test is typically at very low cost or free, and we'll send it off to an external testing center that will then give us a result within weeks to months. And at your follow-up, we'll review the results with you, and there will be a genetic counselor involved that you can have a discussion with, who will go over all of the results with you if you have any questions as well. I always tell patients that there's a couple reasons why knowing is empowering. If you know, it helps you make a decision on whether you would be available for any sort of treatment. In the future, obviously, we're hoping there will be more treatments available specifically for your gene. If you're the first one to manifest certain vision symptoms, if you realize that you have a certain gene mutation, you may want to also tell your brothers and sisters that they should also get checked out so that they can start taking preventative measures. And the genetic testing will give us a narrowed down sense of exactly what gene is causing the disease. And once we have the precise cause, the DNA-based cause, the hereditary cause of what their inherited retinal disease is, then we can start to find the treatment of their disorder. And we're hoping that in 5, 10, 15 years that there will be treatments for these patients. And really that is not a long timeline. People think of 15 years as the horizon, but many of these patients are children that don't have any hope. Teenagers that have seen eye specialists have told them, I'm sorry, you have retinitis pigmentosa and there's no treatment. And we want to be able to tell them something different.